Okay, well, um, we're really excited. So we're Energy Events. I'm interviewing Marcie Denton, and this is about light therapy research, what's happening right now in the world with light therapy. Both of us have been using photobiomodulation for about 10 years or more. There's lots of different devices out there, some that we use, some that we know about. And but what's exciting is how Marcie is on research and what's going on in research. Now, I'll just start by saying a couple of weeks ago, President Trump said something about light therapy, and a lot of people laughed at him. So whether you love him or you don't love him, the fact is he mentioned that there was something too, that he had been hearing some stuff about light therapy and the possibility of using that, using light therapy at a time such as this. So this is not a political conversation. It is a conversation about people, about our time, about self-care at home, and about what baby Einstein, that's Marcie Denton, what baby Einstein has been bringing to us in the way of the research in the field. So Marcie, what's happening in light therapy research? I know we have that, there's a website called lighttherapyresearch.org, and there's a lot of articles posted on that, and some specific to light therapy, to photobiomodulation as far as the current viruses that we're dealing with.
So we've been working to promote the use of light therapy, photobiomodulation, for health and wellness for years. And we've made little bitty steps. We've tried so hard to make people aware of this gift that we have. And all it took was a misstatement by the president to cause the FDA to be interviewed on a number of news channels. And the commentator would say to the FDA, now, isn't this stupid that he said blah, blah, blah? And the FDA goes, no. Photobiomodulation has been used for years. It's beneficial in many, many ways. So in a light second, in the time it takes to misstate something, we have opened up a door, and it's a big door for the use of light therapy, not just for health and wellness, but as an intervention now for a serious situation that we're in, which is the coronavirus. And so over the last 2.5 to 3 weeks, and so this is what we're looking at when we're taping this, there's going to be way more happening. But the FDA has, in most recent time, identified the product of, or the capacity of light therapy to release nitric oxide as a wonderful miracle molecule. They've just identified nitric oxide as a new drug. They've named it a drug. And they're doing research.
What is nitric oxide, Marcie?
Well, it is a very volatile gas that we've been using the language of it causes terrific help for the cardiovascular system.
Well, where do we get it? Do we put it on our face, or where?
Well, there's we're now using it everywhere. But here's the thing: if you place the light from a light pad of any flavor, I've got one on right now. So if you put this kind of light on your body, then there are specific frequencies for it. We could go into that forever. But if you put that, the cells of the body release nitric oxide.
Oh, so
we already have it. We are already releasing it. But when we put light on it, it adds more to the body, and it adds more health and wellness benefits. And one of those was vasodilation. The blood vessels widen, your circulatory system goes crazy, like wonderful. And now they've discovered that nitric oxide, believe it or not, is an antiviral. How on earth did that happen? I've been teaching about light therapy and how nitric oxide is released using it for years. And I kind of in the background knew it was good for the immune system. I would teach that, but I didn't know what I now know. So where
Well,
we are
let me just jump in and say that one of the first things I ever heard about the recent, 10, 12 years ago, about flooding the system with nitric oxide by putting light on the, a lot of high quality light, photobiomodulation, and the release of nitric oxide, was that one of the many things that research was pointing to was that it stimulated not just circulation and reduction of pain and inflammation, but that it among many things, it promoted phagocytosis, so making an unfriendly environment for pathogens. So I think that we knew that as a background benefit. We didn't know specific to specific families of viruses until you, for me, brought up that research article that was done in 2005.
exactly.
Right. So you want to talk, just mention that?
Because it's a little bit of history is that we had a virus called SARS that was causing havoc. It was a coronavirus. It has those little pointy things on it. And they discovered and did research on nitric oxide having the capacity to kill that virus. And then it went dormant because the SARS virus sort of pooped out. And so we really didn't have follow-up research on that until we have introduced into our world the coronavirus, which is a brother sister to the SARS virus. And that's where the interest has perked. It's gone, oh my goodness, what does coronavirus do that is so dangerous to us? And one of the newest research articles is that they discovered recently, like within the last 2 to 3 months, they've published that the coronavirus, the COVID-19, takes out our normal immune system, the interferon system. It is denaturing it. And so we walk around with viruses just replicating in our body how viruses make new viruses without any symptoms, no fever, nothing. But we're infected and we're infectious. So what does our body do? It goes to the secondary immune system, which is nitric oxide. Now that is critical to our understanding of the value now in our time, not just for health and wellness and general health and wellness, but for specific immune support. And that's what's exciting. So the FDA is searching for all kinds of interventions that will work. And they're putting down and they're slapping down all the people who are making false claims. So one of the key pieces to what we are doing is we are working with a consultant who is helping us do what the FDA wants us to do, show that light therapy intervenes and changes the inflammatory response. And once we can show that, which doesn't take a huge deal, we have an IRB set up, we've got informed consents, we've got the program almost on its feet. Once we can prove that there's a change, we get an emergency authorization to use that language and tell more people how valuable light therapy is. So if you have light therapy devices, turn them on, use them. If you don't, we need to know.
Oh, there's some background noise. I don't know where that's coming from. Is that from you? But there's, many of us have had light therapy devices for a decade or more or whatever. And if you hold up the pad again, most of us, if you have different types of systems, light's good for us, right? Most of us have some form of a pad-based system. The ones who are, even know what photobiomodulation is. But a lot of people, it's in their closet, or they only use it for, super relaxation, or when they want to meditate, or when their knee hurts, or they have a back pain, or something like that. But, we're telling everybody, get those systems out and stimulate your immune system, and come on, make sure you've got plenty, you're flooding your body with lots of nitric oxide, because the research points to the fact that, you put that on there, and it doesn't take long and you're flooding your system. So, Marcie Denton, so I'm Ginger Bowler with Energy Events and Products here in the Boulder, Colorado area, in a town called Erie. And Marcie Denton is in Kerrville, Texas, and she has MMD Wellness. And so Marcie and I actually were two of the people that designed the light therapy certification course, and along with Isabel Martinez. But Marcie, you say more about the research right now.
Right. I'd like to talk about just what you mentioned, that the FDA has cleared many light devices so that we can claim that it reduces pain and improves circulation. We talked about the nitric oxide causing vasodilation. But what is new information is a very specific way that when you apply light to the cell, it interferes with the transmission of pain. So you can rub pain. You can hit your finger or elbow and rub it, and you're sending a second message. And sometimes you'll go get a shot and they'll slap you like this so that the shot doesn't hurt. That's to send too much information so your brain doesn't get the pain message. But you can also stop it in the spine with opioids. So these are endorphins. These are natural chemicals that block the messaging. And lo and behold, guess what blocks the messaging inside the spinal cord? Nitric oxide.
Nitric oxide.
I mean, we just keep saying, well, maybe it's a real miracle molecule after all. That's its nickname, is the miracle molecule. So the more we look at the value of having light, besides the beauty of using it for relaxation and de-stressing, and the emotional component of using light, which is all there, it's the improved cardiovascular system, it's the improved immunity system, and lo and behold, we now have a little bit of a peek of how you use light to remediate pain. And the exciting part is it's not that hard.
No, but
if it hurts, you put the light where it hurts and put it on the back where the nerves go up to the brain. I mean, it's like, oh, okay, we can do this.
Right. Right. And we've been using our systems for a long time. I know my family counts on, ours for, health and wellness, just general health and wellness. So my daughter used to count on it for her pimples, when she was a teenager, like all the time. But, it's really exciting. And I do want to point out to our listening audience that we're saying nitric oxide, not nitrous oxide. Nitrous is a laughing gas. But so I'm just really excited about the research that you're about to, that you are embarking on. We've got about a minute left. You want to?
Let me tell about the study.
Yeah, and we'll finish up with that.
We'll finish up with that. So the study will be presented to a board, and they will look at it. And the study is to show that there's an improvement in the inflammatory markers, which means in the blood, that when you place light on your system, inflammatory markers are telling you that there's an immune response because you've got an injury or you've got something wrong. And so that causes the pain. That's one way that you get pain, is the inflammation. So when we reduce the inflammation, we're reducing the pain. COVID is an inflammatory illness. So the concept that we would then go next to say, because we show improved inflammation, we have a benefit to intervention once or if someone does get infected. We don't know how that's going to play out, but it gives us a door to the community of people in this world who need interventions that are non-invasive, non-medical, non-drug, and easy to use to do an intervention for health and wellness, and now to give us a leg up on the situation we're in with viruses.
I'm sorry, I had muted the kids playing in the background sound. And to be able to do this at home, self-care at home is what I keep saying, because in this environment that we're currently living in, even as the states are opening up and this is a global event going on and people are staying closer to home. And if we can avoid having to go into a practitioner's office, we're trying to take care of ourselves at home. So that's an exciting thing about photobiomodulation. It's safe and effective. People can use it in their own home. But all the research coming out and the fact that the FDA is kind of like embracing us. And in the past, researchers like us or light therapists like us, and trying to present the kind of research that you're presenting right now or embarking on this particular project, we might have been laughed at by the FDA, whereas now they're saying, hey, we know there's something to this whole light therapy thing and to nitric oxide, and so bring it on. So it's a super exciting time for us that have been working for decades in this field of the body's natural ability to heal itself if it's given the proper information that it needs, and light is needed by every cell in the body. And now we know even more the reasons why, because the release of the miracle molecule of the body, a lot of research demonstrates that photobiomodulation helps the body to release nitric oxide. So, hey, this is awesome. And for our listening audience, if they just go Google nitric oxide, and see. But then go on over, let me just screen share real quick the light devices. No, it's called Light Therapy Research. Let's see, this is this is where there's a lot of research about light therapy, this kind of light therapy, and there's different kinds. You can see this thing is looks like LED in a dome, but Marcie picked up one, but it still would be applied to what we're talking about. She showed one in a pad, but up here you can see the different categories that they have. So it's just exciting how much stuff is coming out. Okay, so thank you, Marcie. And how can I get in touch with you if they want to be coached by you, let's say, or they want to help in a study design or do a study themselves or anything? How could they get in touch with you?
My web address is mmdwellnessgroup.com. And I am Marcie Denton. And generally, if you put MMD, it'll show up wellness group right away. And if not, then type in the next word and it should show up. I do have a phone number that I am screening as we're getting all kinds of calls. So make sure you leave a message. It's 210-771-6498. Let me say that again. 210. Text me first that you're calling me, and it's just the way we're getting. People have to earn a living, so they have to call. But I'm so glad to be able to share this, and there's so much more information that might be helpful. And if you are a practitioner and want to know how to work with individuals, I'll be happy to work with anybody. So.
Yeah. And so I'm Ginger Bowler, Energy Events and Products, and my email is ginger@energyevents.us. Thank you, everybody. And thanks, Morris.
Hey.
Baby Einstein.
Yeah.